Hi YouTube, this is Point Shooter. Today I'm going to be doing a very serious video about major first aid, life-threatening conditions that require immediate first aid. This is an M3 medic bag that I have outfitted to deal with major injuries that would involve, that would quickly result in a loss of life. This kit, part of the reason that I've decided to show it this week is due to the shootings in Colorado. The terrible tragedy that took place there and the mass casualty situation. I was told there have been over 70 people that were injured in that shooting, and a kit like this would be a good first step in dealing with some of those injuries. This is a kit that I recommend for inclusion in vehicles, and also, as much as I hate to say it, in your place of work. That we stand with the chance of the active shooter anywhere we go now. And it's something that I think would be a lifesaver in a critical situation. So the kit itself, this is a standard USGI M3 medic bag, 3-compartment kit. It's got a carry strap. It's got a nice nylon flap on the top here. Let's pop the buckle and get in the kit. 3 compartments. You've got 1, 2, 3, and a small sleeve here where you can keep small items. I keep sterile gloves in there. This is the Booboo Pouch. This contains instruments and just miscellaneous items, and this is the part that covers life-threatening injury, major hemorrhage, things that will kill you fast. Again, if you're not into talking about blood and things like that, this video may not be for you, but we're going to discuss some serious things here, and I really appreciate those who are going to take the time to watch. So let's get into the first kit here. There are dual zippers. You can have them in the center to open out. I usually keep them just at one side. First thing right off the top, a 4-inch and a 6-inch emergency bandage. These are known as the Israeli bandage. These are in use currently by the U.S. Army and other the Marine Corps. They are current issue to the U.S. Armed Forces. These are hemorrhage control compression bandages, and what they are is a replacement of the old U.S. GI bandages. These allow you to have a pressure dressing. This is the first line of defense against major hemorrhage. You have a major bleeder, gunshot wound, something. This is the kind of dressing. It has a big pad, a 6-inch pad that you or 6-inch or 4-inch pad. Place it on the wound, and it has tails that wrap around, and it has a special buckle that allows you to really tighten down and apply direct, firm pressure to that wound. This dressing could save your life. I include 2 in the kit because I feel that you could have 2 people that are injured. You might have 2 different wounds. These are something that you need to have. These are available online. They have expiration dates, but as long as they stay sealed, I would trust my life with these. One of the things that is the disadvantage of these is that they're expensive. Most places they're $7 to $10. You can get them off eBay. I recommend that you have several. Next, this is what I was talking about. This is what was replaced by this bandage. These are from the 1980s, but I think they made them up until the mid-2000, maybe 2005, 2006. They might still make them, but these are field dressings for the military. These are a 4x7 pad that has tails. They're basically just like this, but this has the buckle that allows you to do pressure dressing, and these are a lot tougher. I've used both of these. I had a situation at the gun range where a friend of mine cut his finger really bad, right down the finger, and I didn't need one of these bandages, but we yanked out one of these out of the case and were able to stop the bleeding very quickly. I include 3. If you have multiple gunshot wounds or other injuries, you may need to deal with several people, and these bandages could save someone's life. These are very cheap. They're generally available at your local surplus store. They come in the old the compass pouch or the bandage pouch. You can find these $2, $3. If you're lucky, you can find these by the crate. Some military surplus dealers have them by the crate, and you can buy bulk items of these. So I recommend these go in every first aid kit that I have. If I don't have room to include these, I include a bunch of these. So together, this gives you a lot of wound stopping capabilities. Next item, Cit Tourniquet. This is by North American Medical Products. It's a Velcro tourniquet. You place it around the limb and then tighten down the windlass. Tourniquet is to be used in severe hemorrhage situations where you can't control the bleeding by any other means. Again, I'm not a medical professional and I'm not giving professional advice, but I include the tourniquet because if you had a partial amputation or a serious situation where pressure dressing alone was not enough, this will prevent that person from bleeding out to death. This could save someone's life. Next, I have a Cpr Airway. This is a really old one. I think this one's from the 1980s, but I included it in the kit. It can do infant or adult. A quick clot advanced clotting sponge. This I've never used, but I decided to include in the kit that you could use this on a bleeder. Generally though, I would prefer to use the regular bandages with direct pressure, but I have this if all else fails. Next, I have two of these. These are 1980s era USGI muslin bandages. These are triangular bandages. You can make slings from these. They have a whole chart on the back. You can do all kinds. You can make a tourniquet with it, head and eye. You can do knees. They are really versatile. They open up real big. They have safety pins. You can do a lot with these, so I include two. Next, let me go to these 3 packs of Steri-Strips. These you could use to close a wound. These I kind of consider more of a finishing item, sort of more of the Booboo items, but you could use these if you had loose pieces of skin you needed to tape back in place, like a head wound where part of the skin was hanging. You could use these to tape the wound back in place. So I include a bunch of them. Now, let's get into some of your blood stoppers. These are sponges, 4x4s and 3x3s, and these are Telfa non-adherent. The idea is you want to stop the bleeding, but you don't want to stick to the wound, because if you stick to the wound, you're going to then, when you remove the dressing, it's going to reopen that wound. You can use these to dab away the blood, use these to help get pressure on that wound. So I include 10 of the 3x3s, 1 of the 4x4s, and some of these 3x8s. Now another thing I want to talk about is a sucking chest wound. Bullet to the chest, something has pierced the chest wall, and when a person breathes, you can hear the air coming in. You need to correct that immediately. What you can do is take the wrapper of this, cut it open, lay it out flat, and tape 3 sides. Duct tape, masking tape, whatever. 1, 2, 3, with the down side facing down, the open side facing down. And what it is you're creating a flutter valve. You can buy these commercially. They're called an Aspirin chest seal, but it's very easy to make these. You take the inside, the clean part of the bandage, and put it against the person, and when the person breathes in, it does not allow air to enter the chest, but when they breathe out, it allows air to come out. If you allow that sucking chest wound to get air in, you'll get what's called a tension pneumothorax, where the air in the chest causes the lungs to compress the heart, and that can lead to death very quickly. The U.S. Army IFAC kit includes a 14-gauge chest decompression needle. That is something I don't have in this kit. I have everything else basically that is included in the IFAC except for that and a nasopharyngeal airway, both because I'm not trained to use them. But the items in this kit really could save your life. You need to understand about these sucking chest wounds because that tension pneumothorax can kill someone. Next, pair of trauma shears. In a lot of cases, trauma shears kind of suck, but this is a good pair. This is a nice solid pair that I've had for a while. I include these if you had to cut away clothing, cut a bandage, something. Next I have 1 sterile and 2 non-sterile gauze wraps. These, if you got the bleeding under control and wanted to wrap that wound as you were heading to the hospital or somewhere, these are nice, big, fluffy, absorbent gauze that you can use to help wrap a wound. Next, I have a copy of the Tactical Combat Casualty Care book. This is an Army publication. I don't know if it's available in the civilian market, but I have a copy of it. And this covers basically everything about wound care. This is something that you want to read before you're in that situation. You don't want to be saying, oh my gosh, somebody's bleeding. Let me look. This is something that you need to understand, and it's something that I've read. I include it in the kit as a backup because it's something that I really value. Next, this is something that I really hope I'd never have to use. This is a large 11 3/4 inch square abdominal bandage. You can see the pictures on the back for a large chest wound. Again, to be a little graphic here, there could be a situation where you've had major injury and internal organs have come out. You don't want to just, pick those up and stuff them back in. This is something that you can use to cover up a major chest wound. If it comes down to this, it's a really dire situation. But I include it for a large injury. 2 pairs of sterile gloves. They don't you could use regular exam gloves, but I just include these because they're nice. They're in the bag. You need to use them. You just rip them open and you've got your gloves. This is a small bottle of eye wash. Well, these are just liquid gel drops. You want to include a large bottle, something like this, of eye wash that allows you to have pressure to squirt out the eyes. If you've had chemicals in the eyes, something in the eye, you need to be able to flush that out. You can do it with these, but something like this is even better. The other thing that you can use these for is irrigation. If you need to clean out a wound, maybe flush something from a wound. These are important. You want to have a large bottle. Bausch & Lomb makes a big one. I think it's a 8 or 10 ounce, and it comes with a little eye wash cup on there. It's a perfect thing to include. I keep one on my desk at work. That's why I don't have it in this kit, a Bausch & Lomb, but something that you can use to flush the eyes. Another item, burn gel. Maybe you got burned on a toaster at work. Maybe you've had an explosion, something. You can use burn gel to cool down that area and help soothe the patient. And the last thing in here, I think that's the last thing, this is a SAM splint. I've had this one for a lot of years, but if you had a break and needed to splint it, it's that aluminum with foam. You can use it to, it's non-sterile, but as long as you're just splinting, you can wrap with gauze, you can sterilize it with alcohol pads. It's a nice thing to have. It's bulky, but it's good to have. So, that's the main kit. If you have someone who's bleeding out, this is the pocket to go to. It has everything, in my opinion, that you're going to need to control that bleeding. You've got your trauma bandages, you've got your gauze pads, you've got your everything. So the next, all I have in here are just 2 more sets of gloves that are quick access. Maybe it's something that is not medical, but you just need to get to some gloves for something. I recommend that you wear gloves when you're dealing with someone. You don't know what germs you have on your hands, and you don't know what that person has. With all of the diseases out there, hepatitis, AIDS, you need to make sure that you protect yourself. Another thing that I'm going to tell you about is the Good Samaritan Clause, also known as Good Samaritan Act, Good Samaritan Law. Research your state and find out what your Good Samaritan Act is. In the state where I live, if you render aid to someone without asking for money in return, you are protected if that person dies. A lot of people probably say, oh, I don't want to get involved with somebody who's been shot or is bleeding out. You know, they might die and then I try to get sued. Good Samaritan Clause has you protected. I recommend printing out a copy and including it in your first aid kit, because if you ever go to court about it, you have record that you knew about it. It's something that I recommend including. Next pocket here, this is accessories and just some excess. First thing up here, this is a non-needle syringe. This is an irrigation syringe. If you had to flush out a wound, you could fill this with clean water and use it to irrigate a wound. I also include a small vial, a 20 milliliter vial of irrigation solution. I have a small bottle of aloe vera. This is for sunburns. You could also use it topically on other kinds of burns. Just a small bottle. Package of hand warmers. We're in summer here, so this is sometimes a comfort item, but sometimes the heat on a wound can help soothe the wound. Heat therapy. These have a lot of different uses. Next is a small sewing kit. This again is sort of a convenience item, but the first aid kit is going to be with you. If you need to sew something up, you can do this. Now, what some people might say is, ooh, you could suture with that. I don't recommend that. I would use the Steri-Strips, and I'm looking for them here. Use Steri-Strips. Let me grab them here, because Steri-Strips, they're easier to do than sutures. I don't have any experience with sutures, and I'm not going to go suturing somebody up because I don't have the experience, but I will use a Steri-Strip. Next, these are just some 3-inch non-sterile gauze rolls that you could use to wrap something. This would be, these large ones would be if you have a large wound. These would be if you have a smaller wound. Next, I have a space blanket to help prevent someone from going into shock. Maybe it's outdoors. Maybe the person is cold. Maybe they've been in the water. This is something that you could use to raise somebody's body temperature and keep them from shock. Next, I have another one of these. I have a 6-inch and a 4-inch elastic bandage. These are just ACE bandages. These are the old style with the clips. The new ones are self-adherent, where you wrap and they cling to itself, not to the skin. I have these. I have a bunch of these, so I include 2 of these in here. Maybe you have a sprain. You need to use it. You could use this to add extra compression to a dressing. There's a lot of different uses for an elastic bandage. Next, I have 2 Chem Lights. I have a green and a yellow. I recommend that you have 2 because if one fails, you still have the other. This is hands-free instant light. In a situation you don't want to be messing around with looking for your flashlight or whatever, so I include a Chem Lights. I also include a small pen light. Most people watching this video, I'm sure, carry a flashlight with them most of the time, if not all the time, but have a separate one in the kit. This is just a cheap little pen light, but it's something that's there. It's always ready in the kit. I have a small tube super glue. This is hopefully just for gear repairs, but you could also use this as a wound closure. If things got ugly, you could use it to close a wound. I have an albuterol inhaler. I'm not an asthmatic, except with exercise, but if you come across somebody who has an asthma attack, this is something that you could use to help them. So the other thing that I might include, if you have access to them, is an Epipen. Someone's having anaphylaxis and they don't have their Epipen, you've got it. I believe that you can order these offline. Some of these are probably prescription items, but if you have access to them, I recommend you include them in the kit. I believe that's everything in the second pouch. So this is the non-life-threatening injury pouch. This is for boo-boos and small cuts and abrasions. First, Band-Aids. I've got 2 different packs of Band-Aids, and I also have a small finger splint in here. This has mostly the Next Care, and these are antibiotic Band-Aids. I've had them a long time. I had to make sure they're still in date. And then I just have regular Band-Aids and small butterfly closures. A word about butterfly closures. Do I prefer them over Steri-Strips? Really depends on the application. Butterfly closures do a good job. Steri-Strips do a really good job. The question is, these are in packs of 10. Do I want to open a 10-pack of Steri-Strips and then not have them sterile if I could just open one butterfly closure? It's really up to you. I have large Band-Aids, small Band-Aids, tons of Band-Aids in there. Next, this has sterilizing wipes, as alcohol wipes, iodine wipes, and wet ones. It also has Sudafed, Imodium, and Advil. Those are some of the drugs that I've used. Imodium, if you have diarrhea, that can be a real pain, especially if you're out on the trail or somewhere. Diarrhea is going to be a real big thing, so I recommend you have something to deal with it. And the wet wipes allows you to clean up a wound or clean up yourself before you administer first aid or after first aid. I have a bag of Tylenol. I recommend you keep things in the container, but this was just easier to pack. Tylenol, a word about painkillers. The ones that I use are Tylenol and Aleve. I don't use aspirin products. Aspirin is a blood thinner, and in the event of major hemorrhage, you definitely don't want to be giving someone something that it will thin the blood. That's my opinion. The U.S. Army does not allow aspirin on the battlefield, is my understanding, because of the blood thinning agent. So you want to have something that's not going to cause a person to bleed more. I use Aleve for aches and pains, Tylenol, headaches, different things like that. You could include Excedrin migraine. There's a lot of different, maybe Motrin is your thing. In the bottle that I keep at work, I have Motrin, Aleve, aspirin for if you had somebody with a serious condition like a heart attack or something. I have Aleve, Advil, every one of the different painkillers. So if someone says, hey, does anybody have any Advil? I've got it. Next, there's a small flashlight in there. Again, just a redundant item. More wet wipes and water purification tablets. This is not a survival kit, so why would I include water purification tablets? If you had to mix up irrigation solution, maybe you had a bucket of water that wasn't clean, out of a river or something, you can use water purification tablets, clean it up. Sterile eye pad. If you have an injury to the eye, this is something that you could tape in place. You could use a standard gauze pad, like the ones that you've already seen, but it works just to have this. I also have 2x2 sponges, 3 of those for smaller cuts. You can use these to apply pressure and get the bleeding under control. Another hand wipe. This is how I like to package my gloves. Label what they are. These are large nitrile gloves, which are important if someone has a latex allergy. You definitely don't want to be using latex gloves if they have an allergy. So I stick with nitrile. I don't think there actually are any latex in the kit. I don't believe these are. These are latex. So I keep the latex sealed up, but I use nitrile for most situations. So what you do is you fold the gloves out flat, roll them out flat, get all the air out, roll them up, and then tape a piece of paper around. It keeps them from getting snagged, keeps them from getting holes, and all you do is just rip the paper off and they're your gloves. I also keep some loose gloves, and I have white and I have purple, and a couple pairs of the white. And a word about the purple gloves. These look blue on camera, but they are bright purple. These are a shout out to my favorite TV show, Warehouse 13. So in a WROL or a major situation, these are the gloves I'm going to be rocking. So have latex gloves. You want to make sure these don't have holes in them. You want to keep yourself safe. I have 2 tubes of chapstick. Do you need 2? Probably not. I had extra. We have a lot of chapstick just laying around, and I have 2 in there. This is sort of a comfort item, but there's a wide variety of uses for chapstick. You can use it as a fire starter. It's just a good item to have. Sharpie Marker. This is an important item, and usually I will keep it in the big trauma pack, but in this kit it was just easier to find it in the smaller kit. If you apply a tourniquet to someone, you need to note the time. You need to write on that person's forehead the time the tourniquet was applied. Also, if it's under clothing or it's not quite visible, you need to make sure that the medical professionals coming in know this guy's got a tourniquet. A little bit about tourniquets, going back to the major trauma kit. They are in use now. They are still considered a last resort, but if you get a person to a surgeon within a few hours or very soon, generally you're not going to lose the limb. That is what I've been told by a friend who is a combat lifesaver. He has said that as long as you get that tourniquet on and get them to a hospital, they're going to be able to reopen those blood vessels and save the limb. So tourniquet and a marker. It's also good if you need to write something else down, maybe write latex allergy, penicillin allergy. If you have information like that, write it on the person's forehead so when they get to the hospital, if they've passed out, they know that information. I have a tube of Benadryl. This is for poison ivy or bee stings or any kind of stings. Also Neosporin. The one thing that you don't see in this kit that I normally include is a bottle of 2% tincture of iodine. 2% tincture of iodine is a great disinfectant, but it's good to have an antibiotic that you can use to put on top. And then got another glove in there. These are just some Sucrets cough drops. It's nice if you have a sore throat. And then medical tape. So the last 2 items in there. Oh, I'm sorry, safety pins. Include some safety pins. If you lose the pins for your other kind of bandage, you can use these for all kinds of things. You can use the tape. These are different types of transport. 3M transport is my favorite kind of tape. I'm having really good success with the white stuff, but I've used the clear stuff for years. This is available online or hopefully at your local drugstore. So, that covers the kit. One of the things that is nice about this kit is that it doesn't take a lot of know-how to apply these things. Most of these bandages have the directions on there. You just rip open the pouch and the paper packet has the instructions. It doesn't take a genius to wrap gauze with a wound. So if you get injured, someone else is able to use this kit to help you. I cannot stress enough these bandages. These are an important item to have. You need to have something to be able to stop that blood, because if you don't stop the bleeding, that person may bleed out and die. That's not something I want on my conscience, so I'm going to do everything I can to help that person. Anyways, guys, I hope you find this video useful. Remember to stay safe and always take precautions. The best way to treat an injury is not to have it. So be safe, use caution, stay safe out there. This is Point Shooter signing out.